No. It might work because it belongs in the same family, right? Herpetic viruses. But no, it's not the same protocol for herpes. You should have herpes in your handbook. And also in the handouts, you have how to dose children. I've put that in there as well. So we'll talk about that, but one thing that I use is, one herbal combination that I like to use is BioSidon. Okay, it's very simple. It's available in the EU and all that. So I was discussing with the group yesterday, right? So we've tried BioSidon on biofilm as well. Of course, dosage will vary, right? So we've done some studies. So they have, from all of their thing, there's two are my favorite is BioSidon, and then they make liposomal BioSidon, for intracellular, for greater intracellular absorption. Just some statistics. See, as you can see, it is effective for all pleomorphic forms of Borrelia. Look at these pleomorphic forms, right? You have the spirochete, you have the bleps and the loops, you have the round bodies, then you have the biofilms. It's very difficult to eradicate Borrelia if you're not careful. And make sure that all different forms are eradicated. This is one example of how to use BioSidon. Right, we can use acute BioSidon, chronic BioSidon, especially when you're traveling and you cannot take, your 200 herbs with you. Then you can take one BioSidon is what I take when I travel. I have it right in my bag. It's very strong. It's very effective, but be careful. Start low and slow. Start with 1 drop and see how you feel, especially for children. Okay, this is more for the doctors, just a rough idea. Once again, always look at your patient's clinical picture before following any information on the website. This is good information, though. This is great. And these are the two things I use, right? BioSidon and BioSidon LSF. Those are the two things that I use. Yeah. So when traveling and when you have very, very reactive patients, we'll address a little bit of mold and biotoxin illness tomorrow. So they cannot tolerate too many medications. When you're exposed to mold for a very long time, you develop what is called as multiple chemical sensitivities. And in those patients, pretty much, BioSidon can be used for a lot of things. Children, adults. Okay, so it's a lot, right? So it's important that we don't rush. Trust your body. Don't panic. No anxiety or panic attacks needed. As I said before, any practitioner that tells you that you have to go through a Herxheimer reaction, you don't have to. You may have to, but you don't really have to go through a severe one. Make sure that you always start low and work yourself upwards. So if I prescribe a target dosage of like 20 drops of each herb for my patient, I always tell them to start at 1 drop. And then every few days, increase by 1 drop, okay, until you reach the full dosage. right? Usually nobody goes back to their old life. There's always going to have to be a new normal, and the new normal is usually better, is what I've seen. Definitely, improved lifestyle, no more toxic people in your life, but, better boundaries. You learn. You end up becoming a strong advocate for yourself and your family, and you learn to say no. You learn to say stop. That's too much. We don't want to be involved in that rubbish. And we like to lead a stress-free life. Don't bring your problems into my life, and so on and so forth. So better boundaries and improved genetics for the next generation. Right? So cute. You're aware that Lyme disease can be sexually transmitted and also transmitted in utero. It can be transmitted to your child. That's what happened to me. But yes, it can be transmitted in utero. Dr. Jones has a lot of material, data, and work on this, a lot of studies done on this, right? The maternal fetal transmission of Lyme disease is a reality. So those of you, I'm sure everybody here felt that they have Lyme disease, after going through this. But some of you might, right? Some of you might, and if you're planning on having a child, just investigate that. Investigate your MTHFR, if you have any genetic mutations. It's important to avoid or to minimize the chances of autism. All of this, it's important to do your homework before you have children. It's not trying to make it complicated. It's just those of you who are interested in this, just pay attention to that. According to studies, the spirochete has been isolated from semen, not from female body fluids. So scientifically speaking, it can be transmitted from male to female, but, it's just common sense, it can go both ways. But there have been no studies. I guess nobody is interested in studying that. I guess there's no research going on. But yeah, one-way transmission has been shown in research. And clinically, anecdotally, there's hundreds of anecdotal evidence available that it transmits both ways through both partners. Now, let's talk about Buhner's protocols. We have them. Okay. Okay, so as you can see, when we are using herbal protocols, we need to look at the first 5 steps, right? We need to enhance immune system, immune function. We have to bring down the inflammation, meaning we have to inhibit the cytokines in the body. Then we have to look at specific symptoms as well. We have to provide antibacterials, herbal antibacterials as needed. And we need to find a good support system for each patient. Friends, family, whoever is willing to be there for you, right? Then we have how to calculate the herbal dosage for a child. That's right there for you. In pregnancy, I do use herbs, but that has to be an expert herbalist to be able to guide you. There are many herbs that are beautiful for use during pregnancy. They regulate hormones. They help induce labor even if it's delayed. There are herbs that can help with the baby's health as well. But you need a proper herbalist for that. But otherwise, as a whole, it's not good to self-treat with herbs during pregnancy, right? Homeopathy is okay during pregnancy. I've treated brand newborns with homeopathy, and it works just fine. Okay, go through that and let me know if there's any questions. So there's protocols for borreliosis, for specific symptoms, right? If there's brain fog, if there's visual issues, weight loss. This is just absolutely mind-blowing work by Buhner. There's Bartonella, Babesia, Mycoplasma, Chlamydia. And then what to do after getting a tick bite, that's in there as well. Then after that, there is a whole list of herbal antibiotics and antivirals. Yep, there's your Epstein-Barr. Is there any dengue fever here in Lithuania? No dengue. How about the chikungunya? Chikungunya? No? Okay. I've given you some important dental herbs. You need me? You okay? I've also given you some important dental herbs, so you can have a look at that. Those, I usually like to combine, and this is not Buhner's work, this is my work, my research. So these are some of the dental herbs I like to use, along with the Ayurvedic system that I have highlighted here for you. The Zika virus protocol is, of course, Stevens. I don't believe Zika virus has come to Eastern Europe, right? No, that is South America, and then it migrated to North America, and it's pretty serious. But you guys don't have it yet. That's good, and I don't have it, so I didn't bring it. Okay. Any questions? Anybody from here?